Thank you for joining. This is our Systems for Action Research and Progress webinar series. We have about two of these every month where we showcase different research projects in the Systems for Action research portfolio, and you can follow along with them as they learn things in their project. And you typically hear from them at the very beginning, in the middle, and again at the end. Today, since you probably already know since you registered for this particular webinar, this one is titled Unpacking Systemic Racism as a Barrier to Access and Engage with Services. And this particular team is coming to you from Washington University in St. Louis. And if you recognize Dr. Trish Kohl's name, it is because she has also had a previous Systems for Action research project. And this one is a brand new developmental project that Dr. Kohl and her team are kicking off. And this is the first time that you're going to be hearing about this specific project. This one was funded from a funding opportunity that we released back in the beginning of 2024. And they just got started in September 15th. So you're going to get to hear all about what they're planning on doing over their 12 months. Um, Probably should have said at the top of the hour, my name is Carrington Lott. I'm Deputy Director at Systems for Action, and I will be leading us through moderation today. So kicking you off with a welcome, and then Dr. Kohl and the rest of her team will present on their research project, and then we will save time at the end for Q&A. So if you have any questions at any point during today's presentation, please locate the Q&A box at the bottom of your Zoom screen, pop in your question, and we'll reserve some time at the end of today's session to address those. Dr. Kohl, can I get you to move to the next slide? Thank you. So this is our agenda. We're here at the welcome. Then we'll have about 35 to 40 minutes for the presentation. We'll have some commentary from Jessica Price, speaking to the importance and relevance of this research project, and then we'll have Q&A. Last bit of housekeeping before I go ahead and hand it over to the team is that today's session will be recorded. We'll email out the recording as well as a PDF of the slides from today. And with that, Dr. Kohl, I'm going to go ahead and hand it over to you.
All right, thank you, Carrington. So I will be presenting today along with my colleagues, Dr. Banks and Dr. Navsaria, and we have a fourth investigator, Dr. Jean Hunleth, who couldn't be with us today, but will share the focus of the work that she is leading in our study. So this study does build on the first RWJ funded grant around aligning delivery and financing systems to prevent adverse childhood experiences in St. Louis. It brings early childhood mental health services and mental health equity more to the forefront of this work. And we do want to acknowledge the Robert Wood Johnson Foundation, as well as the Administration for Children and Families, who has funded pieces of this of the work, as well as for the Vision for Children at Risk, who we could not do this work without. So I will talk about findings from the first grant that has informed this. We'll go over the aims. Dr. Navsaria will talk about our mental health equity framework. Devin Banks will talk about systemic racism and social determinants of health. I'll then talk about the impact with early childhood mental health, as well as the methods. And then we'll discuss the importance of engaging children's voices in research. So just a sampling of findings. And so we went through a group model building process where we did 2 workshops. These were held virtually, and group model building is a collaborative approach that's used to develop a shared understanding of complex problems through the construction of visual representation of the processes. And it does involve bringing together multiple stakeholders and experts then to articulate and map and analyze the dynamics of the system under consideration. And so we did this in order to better understand the cross-sector service delivery and financing systems in child and family serving agencies. We assessed barriers and facilitators to collaboration, and that visual representation, a causal loop diagram was created. So here you actually see that we had stakeholders in each of the workshops from multiple service sectors, and they were well represented. Um, and we use this to develop insights then about potential intervention points to enhance collaboration across organizations. Now, here is that visual representation. It's that these are used to really illustrate both feedback loops and causal relationships within a system. And I'm not going to spend a lot of time on it because, and I'm going to quickly move to themes, but just want to show in terms of feedback loops. So as one thing increases, so here interpersonal and organizational relationships, as those improve, there's an increased willingness to collaborate. And then there can be an increased allocation for collaboration. And so you see that feedback loop. However, then, so going down, as more time and effort is spent in collaboration, then there is a negative impact on the ability to deliver services within one's organization. So that's just an example of sort of those ways the different variables interact to impact the system. And so some of our themes, and remembering that we started out focused on funding and service delivery alignment, and there was a lack of resources, including funding, time, and staff. And those served as pretty key barriers to collaboration. Relationships were seen as a driver of collaboration, both in terms of facilitating resource sharing as well as inhibiting new collaborations. And while the collaboration, the collaborative, the provider network that was in place has a long-standing history in our community of working together. You have people that come and go in that leave, and so there's points at which you feel like you're starting over. Motivation was a factor that was defined, but it was also one of the key pieces that we came away with is that everybody defines collaboration a little bit differently. So we had to come to a shared understanding of what collaboration meant, and having an infrastructure to support the collaboration was absolutely central. Whoops. So they identified several themes to barriers to collaboration, and that's the competition for funding among organizations. And I don't think that'll come as a surprise to anyone. And then challenges in how organizations spent time and money. There was a lot of discussion around discrepancies between agencies who invest in collaboration and those who benefit from collaboration. And those who invest a lot of time in it aren't always the agencies that actually benefit from these community collaborations. And there was a problem of short-term funding. But one of the key pieces that informs the current project is that the group kept coming back to the legacy of systemic racism in St. Louis, with discriminatory housing policies, with high levels of segregation in communities, with lack of investment in those communities, serve as a central barrier to experiences of families in accessing services of African American families, of immigrant families, accessing services and their experiences in with those services. And so after this, we actually did we did 4 focus groups, really looking to understand parents' interaction, these caregivers' interaction with these organizations. And the participants in these focus groups were individuals with lived experience. These were particularly families with lived experience in the child welfare system. That meant they could have had current or previous experience in the form of having a report made against them that they could have, nothing could have happened, or they could have received in-home services or the child removed from the home. And we were looking at what were their experiences, how organizations in St. Louis work together to meet their needs. They were asked about their experiences of trust in these organizations. This didn't include, even though these were families with lived child welfare experience, organizations included Child Protective Services, public health, healthcare, mental health, and social services that were addressing those social determinants of health, because we know that there's a lot of intersection between child protective service involvement, early childhood mental health, poverty, etc. So we wanted to hear about their experiences with multiple cross-sector service systems. And so it was a slightly older sample. These were caregivers. Some were actually grandparents that were the primary caregivers of the child. Most were female. Most were African American, Hispanic or Latino, or multiracial. They had at least, or just over half had at least a high school diploma or a GED. 19% had an associate's or vocational training, and 28% had at least some college. So from that, there were three themes, and one of those themes was that there was a lack of collaboration between organizations that resulted in agency miscommunication and misaligned treatment goals. You'll go, and I'm just going to give one or two. Okay, and one I give more than that, but representative um, quotes, but these were common themes that emerged across the data. You'll go to one person, they give you one piece of information, then you talk to somebody else, and they tell you something altogether different. And when you try to figure it out, okay, which one is it? Nobody knows the answers. And then they went on to recommend that, these organizations that are working with us really need to streamline some of these processes. And another talked about organizations not having the same goals, and so that they were trying to appease meet the goals of multiple organizations that were competing with each other. And this mom had substance use issues, and she talked about going to residential services so she could keep her organization together, while another organization was actually working to move the child out of her custody. And so the struggle with working together when there's differing goals can be a real challenge for families, and a barrier to positive outcomes for families. Another theme was around the experience of the absence of care within an organization, impacting their trust in the organization. This participant talked about, they're being vulnerable with these organizations, but they never call them back. And let me give you a call, but never called back, and so that made them not want to engage at all. And so near the end of this, I've not heard from her. Let me give her a call. And that makes you more trusting. But when they just kind of push you off, they're busy, they're meeting all week, they're in training, they don't call you back, then that can turn days and weeks and months. It's like they don't care. It's like you don't care. Let me read that correctly. And then the other was very specific to experience of discrimination, bias, and racism in in their interactions, and that there was a lack of culturally competent services. But before you open your mouth, before they even look at your resume, before they even know anything about you, they've already got an assumption. Having the middle one is really around having to advocate for themselves because there was nobody within this group of organizations that was going to advocate on her behalf. And she attributed that to being a young Black mother with multiple children. And then the final one, it's like when you're Black and you do good, you're still bad. You do bad and you're just bad. It's just either way it goes, you're going to be bad in people's eyes. And I do want to be cognizant of time and be able to move on. So here's just another one around culturally incompetent behavior, that trying to provide services when they're not familiar with African American values, and they're trying to put they're only bringing their own way of living and looking at anything else as wrong. And then this person actually does go on and talk about it, and then they share that with their colleagues, and that's the reputation that they get. um, so the implications around this is really highlighting the need for better collaboration, um, engaging families on multiple levels, really focusing on parent and caregiver voice, and as well as the perspectives of agency leaders to determine areas that warrant change and new solution and collaboration and improved services. And one of the things we did is we came to the table together with parents and agency representatives and talked about the changes and leaned into difficult conversations. And some were highly receptive to those conversations. Some providers pushed back a little. And the need really for a race equity lens in the service network is absolutely essential. And so this work, as well as some other work we did as part of that grant, really set the stage for this current grant, which is more comprehensively studying the ways in which systemic racism and race-related social determinants of health impact racially and ethnically minoritized families with young children. We want to know more about their experiences. We want to know their perceptions of providers and the ways in which negative race-related social determinants of health impact their ability to access services. And what are the potential strategies to disrupt this cross-sector systemic racism? And so then finally, it's to develop a cross-sector strategy for achieving mental health equity and assessing the feasibility and acceptability of a larger study to test its effectiveness. And in this work draws upon and will inform the Department of Psychiatry's mental health equity framework that Dr. Navsaria will discuss now. Let me turn that over to Neha.
Thank you. So, when we look at this work and we look at the exploration of I'll first talk about health equity itself. It's very important to sort of unpack, like, what are we talking about when we use the term health equity? And in the work of mental health services and looking at barriers, it's very important to conceptualize specifically what we mean by mental health equity. The health equity, mental health equity, it's often a term that is put out there often, but not often unpacked in a way that it becomes operationalized in a useful way. And often in a lot of research, sort of one specific component of health equity or mental health equity might be examined or studied or looked into, but sort of not looking at what are we, when we think about like what are all the ingredients that are required to move something forward in an equitable manner. And so this is where here at WashU, this framework started to come together in the past year. And um, in terms of this particular study, we're also, while we're looking at one particular concept, we want to be very intentional about how all of the information and data that we collect can inform all 7 of these components to make sure we're moving mental health equity forward. And it's important because a lot of times when we think about equitable care, we think about the one that often comes up as access to care. But the example I always like to talk about is, if we're addressing one piece of the sort of equity pie, but not all of them, are we actually moving mental health equity forward? So an example would be, let's say if we extended further access to care for a particular group, but that specific intervention and care is not culturally competent, then are we really moving it forward in the way that it needs to be effective and to have an impact for those groups? And there were already, if you looked at the themes that were already shared in the quotes, that those are all sort of examples of different components. So we can go to the next slide. And I just wanted to run through before we talk about, before my colleagues talk about more specifics about this project, just conceptually to sort of ground everyone, like when we talk about all those 7 components, what are the things that we're referring to in this mental health equity framework? So the first piece is in general, just considering access to mental health care. And it's the right of all individuals and groups to be able to access high quality and affordable mental health care services. And some of the barriers could be due to cost and lack of insurance coverage, just limited options that are available to them, long waits, also lack of awareness that care is needed or that care is available or how care can help, social stigma, and also location where you live and SES. The second piece is making sure that there's an understanding of the mental health disparities that occur. And mental health disparities are considered to be the data that outlines those discrepancies in mental health and also mental health services and mental health determinants. And most often we see these disparities as they relate to race, ethnicity, gender, and sexual identity. We also see those disparities as it relates to SES and also like location and neighborhoods in terms of where you live. The third piece is looking at mental health literacy. So it's the ability for individuals to get access to information on mental health and getting access to information that is accessible, that they can understand, and that they can use in ways to promote and maintain good mental health. The example I always like to give is from like the American Psychological Association. They have a whole initiative about making psychological science available to all and finding multiple ways and multiple avenues to do that. And it's kind of, they call it like giving psychology away. But that's part of it is improving the mental health literacy of society by doing that. So that's just one example. And then number 4 are social and structural determinants of mental health. And that's going to be a particular focus of this project. And my colleague, Dr. Banks, will be talking about that shortly. And in a broad level, it's looking at how circumstances, whether they're social determinants of health, whether they are structural or systemic circumstances in which people have lived and in which they work and the histories have shaped their mental health outcomes. I mean, I've put that just in one bullet point. There's a lot under social and structural determinants of mental health. Things to consider are things like neighborhood resources. So, for example, social capital, educational resources, political power. Psychosocial conditions are another piece to consider. So looking at poverty, looking at crime, looking at discrimination, and then structural factors. So for example, things like zoning laws, policies, state policies, structural racism. Those are just a few. Next slide, please. Then the 5th area is related to having a trauma-informed lens when you are doing this work. So in general, when we consider a trauma-informed organization or trauma-informed service, it's a service system that recognizes and responds to the impact of traumatic stress on anybody who has contact with that system. And so what it means is that elements of knowledge on trauma, skills, and awareness are infused into how that, whether it's a work setting, how the culture is organized, how the culture of the organization, the practices of that organization, and the policies of that organization. And what's important is examining, and having an awareness to the intersections of trauma and with culture, history, factors related to race, gender, location, language, and also structural inequities. So one such example is looking at, for example, the intergenerational trauma of racism-related stress. And you can see it sort of captures a number of those pieces and looking at that from a trauma lens. The sixth piece is looking at community engagement. So much of those focus groups that have already been discussed is an example of community engagement. This engagement gives communities an opportunity to have a sense of ownership, a collective ownership of the programs that are being initiated, the projects, the interventions, by involving them in both the design and the delivery. And a lot of this is achieved by developing a knowledge of the range in which individuals and groups understand and and their attitudes about mental health and well-being in the community. So again, the qualitative quotes that were just shared are related to that. And it ties to one of the other components in terms of informing mental health literacy. So if you're thinking about how to frame and make sort of this information more accessible, what you hear from the community informs that. And also how providers sort of organize and conceptualize their program delivery, their service delivery, and support. And then the last piece, the seventh component, is tied to having providers and team members who are operating in a culturally sensitive and competent and responsive manner. So what the definition of a culturally competent mental health provider is someone who's able to consider how someone's culture, race, and ethnicity may influence their mental health and the best way to treat them. And it's often putting that person in the role of an expert in their life, and also knowing what questions and ways to explore in a collaborative manner with the patient about learning about their perspective and their point of view. And it's very intentional and it's very consistent, and it's sort of actively making decisions about how the ways in which intersecting identities and barriers and stigmas and the historical trauma that's existed for that group have impacted their mental health. So that's the brief overview of those 7 components, and I will pass it off to my colleague, Dr. Banks, to talk about a couple of those components in more detail.
Thank you. Yeah, so I want to talk about social determinants of health in particular. This project is, so let me back up a little bit. We think about social determinants of health. It's a very broad term to account for population level mortality and morbidity and quality of life. So you may have seen this figure before. It is from the County Health Rankings, which is a population health institute funded by or supported by RWJF. And this is their model of the influence of various social determinants of health on mortality and quality of life. It was kind of just a model based on their public health epidemiology, but it's been empirically supported. And as you can see, even healthcare access and quality of care makes up only about 20% of health behaviors make up about 30%, but socioeconomic factors and the physical environment are making up the other half of population level health. So when we think about social determinants of health, we need to be a little more specific, right? Where social determinant of health is not necessarily race or gender, but how race or gender interacts or influences one's access to each of these factors. Next slide. So in St. Louis, where we live and where this project is taking place, social determinants of health at the environmental level have, as Trish mentioned earlier, based on the history of St. Louis and the persistent racial segregation, and income inequality in St. Louis, social determinants have been kind of demonstrated at the environmental level to impact health. So these maps are just an example. You can see in figure A in the top left and B, you see the concentration of African American population and the concentration of poverty. And the intention here is to demonstrate that those areas that have the highest level of poverty and the highest level of African American population seem to overlap with the bottom two maps, which show heart disease mortality rates and cancer mortality rates. So just demonstrating the ongoing legacy of the disinvestment in Black neighborhoods in particular, and how that relates to health. So I talk less in my work about social determinants of health and more about racism related social determinants of health. And these maps kind of demonstrate why we do that. Next slide. So what do I mean racism related social determinants of health? So like I said, those determinants that we saw on the first slide, whether it's health behavior or healthcare access or built environment factors, these are, you didn't see like race or any other marginalized identity in there, because those are not social determinants of health, but they shape social determinants, access to social determinants of health because of our social hierarchy in the United States. So with regard to race specifically, we have a racial hierarchy in the United States that leads to inequitable conditions impacting people of color, and in particularly Black people and Native American people. So how do these influence or shape social determinants? Well, if you think at the level of exposures, those inequitable conditions create two types of differences in behavioral health risk across development. These are this is a theory by John Wallace Jr. That's, I think, is older than me. So I just want to highlight that this is not new, but I bring it up because it's certainly relevant in helping us understand how this influences individual development. So the first type of difference is what I would call compositional. Basically, cultural variability in experience leads to difference in outcomes. A Black child may have a parent who experiences more discrimination, racial discrimination, than a white child's parent would. So that's just basic differential exposure. But then more complicated is those process differences, which suggest that cultural variability in experience can mitigate or exacerbate more traditional factors, leading to differences in their impact. And this is where a lot of my work is. In other words, how do some of these varied cultural or inequitable exposures influence or moderate other kind of traditional indicators that we think of with regard to development, whether it's parental factors or peer factors or some of those environmental factors. And those are complicated questions, but they're questions that we need to tease apart to better understand how systemic racism is influencing social determinants, and thus how we can mitigate those influences and advocate for change. And I'll pass it back to you, Trish.
Thank you both so much. And then building on that and related to that is negative social determinants of health, and cultural and racial social determinants of health do increase the risk for early childhood mental health disorder and decrease access to and engagement with services, and so poverty. And as Dr. Banks made clear, as Devin made clear, the relationship between poverty and race is very interrelated. And in fact, Black children are 3 times more likely to be living in poverty than white children, and so that introduces an array of other service needs beyond mental health. And across multiple sectors, while also placing further barriers on families' access to services. And so the Hermann Center, which is within the Division of Child and Adolescent Psychiatry in the WashU Med School, while we provide clinical services to young children and their parents, we also incorporate a resource navigation model to help families engage with these additional needed services. If they need help signing up for Medicaid or WIC, if we need to connect them to housing or organizations providing assistance with food or utilities. But that said, we need those services to be positive experiences to the families that we serve, not wanting to refer families to organizations in which they're going to experience discriminatory practices, where they're going to be judged or disrespected. And so that's where this study comes in how do we better disentangle those mechanisms in which systemic racism impacts outcomes and access to services, and then to work with a cross-sector group, including parents, to build out a toolkit. And so in addition to the methods I'm going to talk about really quickly here, is that we're working with a parent advisory council and with a provider network that also includes parents, parent representatives or caregiver representatives on their councils. And so we're using, I'm gonna just go take 30 seconds, not even 30 seconds, to go over these. We're using qualitative methods. We're doing an organizational self-assessment. But one of the things I'm really, really excited about is the child-oriented participatory interview methods that Dr. Hunleth is leading for us. So how do we also engage kids' voices in this work that we're doing? And since she couldn't be here today, I'm gonna talk about her contributions with child-oriented research. And she is a medical anthropologist that has done child-focused research globally as well as here in St. Louis. And child participation is a core principle of the UN Convention on the Rights of the Child. And we need to include the voices of children in pediatric global health and use methods that facilitate meaningful involvement, which are typically qualitative, visual, and participatory. I'm going to talk more about meaningful involvement in a minute, but in some of her global work, she's used methods like a dice game, a mapping exercise, reflexivity on power dynamics and role plays. And that's been with older children and youth. For younger kids, there are other methods around drawing and making collages and photography that we'll actually be incorporating into our study to learn about the experiences of young African American children who who are participating in early childhood mental health services, who are participating in, for instance, parent-child interaction therapy, which has a lot of evidence, but we aren't fully certain of the cultural relevance. So what do kids think of these interventions and their engagement with services? So it's really important that we include their voices. Caregivers may be holding a different understanding of what's going on with their kids. I also have a paper in another study that we looked at parent report of child well-being and child report of child well-being, and there was not convergence. So we know this. So we have to include children's perspective, and we have to do it in meaningful ways, and by meaningful ways, and that's throughout. And Dr. Hunliff and her team developed a reflective guide that looks at sampling, design, analysis, reporting, as well as application, and taking into account assumptions, voice, interpretation, biases, representation, and inequity, and then has some questions that we should be asking ourselves around the meaningfulness of child participation. And I believe that you'll have an opportunity, you'll get these slides, you'll have access to these slides where it shows what some of these questions are, but I want to make sure we have time for our commentary and for some questions. And so Jessica Price is going to lead our comment or take on our commentary today. And Jessica has been a part of this work for several years, and really has has been the face of our project within our community, and so has worked really closely on the parents whose voices we've had the opportunity to elevate in this work. And let me go ahead and turn it over to Jessica.
Thanks, Trish. I'm very happy to be here, and I hope that everyone is starting to formulate their questions. It's an amazing opportunity you have to talk to this team today, so please be thinking about those, and we will leave plenty of time for that. I want to just make a few brief points. The first is that this team already has so beautifully articulated the story of St. Louis as a place that has many challenges, largely rooted in discrimination and anti-Black discrimination. And St. Louis is also the story of the United States. And so the opportunity we have with this project to explore these topics in St. Louis provides the opportunity to impact communities throughout the United States. The lessons learned here are going to be key to working through and hopefully making progress on many of these topics throughout the United States. So I hope that everyone will follow this team, follow this project as it goes along, because I think St. Louis is a context for this that could not be a better position to do this kind of work in. As Trish said, I have worked with a lot of the parents. I've had the opportunity talking to a lot of the parents who have participated in the work leading up to this. And when they've described the impact of this work, they have had amazing things to say about how this has impacted their personal lives, their individual families, increases in social skills, increases in access to resources. But when we ask them to talk about the impact on the St. Louis community as a whole, they have conveyed to us that they feel like there's a long way to go before we have impacted the community in the way that it needs to. And I brought a quote from one parent that I think so perfectly describes this challenge. And this parent initially in the focus group shared the many ways that their life was positively impacted personally by these projects, but goes on to describe community impact in the following way, saying, I think we need to find a way to get this out to even more than what we've been doing. Our environment has a lot of layers, lots of layers to it. Things that are set up institutionally that are directly impacting communities, purposefully keeping things the way that worked so well for some people and work the opposite for other groups of people. And so this is the opportunity we have now to dig deeper into the systemic barriers, the systemic challenges, and build on what has already been done, the work, the relationships, the understanding that has already been created, and now dive deeper into the systems level that will hopefully help address the root of what we're dealing with and lead to the outcomes that the team has already, so well discussed today. The final thing that I want to touch on briefly is that this team presented such an excellent example of community engaged participatory research. And what you don't see in a team like this, but which is so unique in my experience, is the way that community engagement is really bi-directional. That not only are they reaching out to hear from many voices, hearing from children, hearing from parents, hearing from providers, but they also are showing up for the community in the ways that the community is looking for. Community is contributing to the research goals, to the research questions at every level, and the research team is showing up to promote the priorities of the community. One small example among many is that when an implementation partner was recently hosting a 2-day meeting for parents that really was not directly related to research aims, the research team provided time, multiple days of time to sit at registration tables, to set up and clean up from lunch. That is the kind of work that this team does in engaging with the community, which positions them to build the relationships, to engage the partners, to really understand and make progress in this area. And I think it's an unseen and unspoken about part of this work, but positions this team really well to be able to advance this topic. So that's all that I have. Thank you so much. This has been wonderful. And I hope that there are many great questions.
And I do want to add to that. Thank you so much, Jessica, that we have done this work in partnership with the Vision for Children at Risk. And I'll reiterate that it could not have been done without that partnership, that the support that they give to our community and families allow us access in very meaningful ways. And I'm going to stop sharing there so that we're all here, and it's any questions or comments at this point.
Perfect. Thank you so much for coming and presenting on what you're hoping to accomplish over the 12 months and for also tying that to your previous Systems for Action research project, since it is sort of building on top of that. And thank you, Jessica, for joining and providing that in-depth guidance and commentary. So as Jessica mentioned, we do have time for Q&A. So if you have any questions that you want to ask, now is the time. I do see that we have one question that has come in. So if you have a question you want to ask, we do have plenty of time for it. So the first question that I'm going to ask the team is from Kiara. They ask, how are community partners and parents compensated for their time and involvement in this project?
That is a great question. And they are compensated for participating in the parent advisory councils. They are compensated for sitting on work groups and helping with and basically any of their time. They are paid for that. For like the parent advisory council and the working groups, it is really an hourly rate at I think it's $25 an hour. For focus groups, they are paid for that. For interviews, they're paid additionally for that as well. So yes, every conversation we have with parents, we recognize that their time is very, very important, and they are in fact paid for that.
Thank you. I think that's a very important question. And I'm curious if you have anything else to say around that about like adding that into your budget when you're submitting these proposals, and then what the communication looks like when you're speaking to the parents before they start becoming involved in the project.
Um, we're upfront about it in that. Now I will say the organization itself, Vision for Children at Risk, actually includes in their budget the money for the participation on the Parent Advisory Council. So that is again, everything they do is for and with parents, and they are compensated. So the time, however, for focus groups and interviews, that is included in research in our research budgets, and it's included in all of my research budgets. And I have to say that, I've been doing this work for a while, and when I look back to 15 years ago, when we were thinking $10 is important. It's quote, I think for focus groups now we're paying $50. So it's their time is valuable, and we need to actually respect that. So I am pretty horrified when I look back and think in the early 2000s, when we were paying or I was paying like $10. I don't do that anymore.
Well, the important thing is that you're changing with the times.
Yeah. Yeah.
Thank you for humoring me for my additional questions on that.
No worries.
The next question I'm going to ask comes from Serena, and they ask, will this team or some other partner monitor what the partners do to make changes in response to this research? And is there an accountability plan?
Great question. And if others want to jump in, just let me know, but I will certainly start with that. So the monitoring change, this grant is to develop the strategy for change. Fingers crossed. We will then secure funding so that we can actually test the strategy and monitor change. So that is certainly our plan. I think that's actually very, very critical. That it's not, we just hand out this information and then do nothing with it. What is the plan? And so we will in fact do that. There was another part to that question.
I think you touched on it a little bit, the accountability plan.
Oh, of course. And I think that is being accountable back to our Parent Advisory Council, back to our provider network, and back to the small working groups that we will bring together that include providers across health, public health, mental health, and social service agencies. So certainly a piece of the accountability is the work with the community and reporting back to the community. I do say frequently, and Carrington, you may want to close your ears, so that with all of these community engaged work, we analyze our data right away and we report it back. It tends to, so I have all this analyzed data that I'm still working on getting papers out, that whole academic model. But we actually analyze the data and feed it back to community in real time, and that has been a commitment of our team for a long time. And Jessica, who leads a lot of that, analyzing that data and developing the reports and presentations, knows that yes, and presenting back to these advisory boards. Yeah.
Thank you. Does anyone else want to jump in before I move on to the next question?
Yeah.
No. Okay. And I am going to reiterate based off of that question. If just in case you joined us late, this is a developmental project. So it's a 12-month long pilot study. So they are testing the feasibility and acceptability with the hopes that they can secure evaluation funding later. I'm going to move on to the next question, which comes in from someone who is anonymous, which is perfectly fine. Will there be ongoing webinars or information shared on the status of the study? And I'm going to jump in and answer first as just a plug for Research in Progress webinars. We do have research teams come back and present on their research projects. So this is the first time that this team is presenting on this particular study. They'll come back maybe midway, so you'll hear some updates at that point, and then they'll present again when the study is over. So you can hear about this through our own Systems for Action Research in Progress webinar series. And we have a list of everyone who's registered for this particular webinar. So we do send you an email about registering for their future webinars. And so that was my little spiel. Trish and team, are there other ways that people can stay up to date on the status of your research?
Absolutely. And certainly on your website, we do have on RWJF's the System for Action, we do have a blurb. And as soon as that question was asked, I will acknowledge I'm not very good about it, but within the Hermann Center, we do have it listed as a funded project, but we will also, as we have findings and projects, we will post those as well. And that is the Hermann Center at Division of Child and Adolescent Psychiatry at Washington University Medical School.
That is
Carrington, I can send you the link to that.
That would be great.
And you can send it out. Yeah.
Yeah, we will include that in our follow-up email with the recording and PDF of these slides. And you'll also have a link to the Systems for Action research project page of theirs. Okay, we've got one more question from Joan. Have upstream prevention strategies for mental health that can universally reach all students in schools have they been considered in the study? And thinking specifically of school-based mindfulness, mental health literacy, SEL, which I'm not quite sure what that means, and adult mentoring.
It's social emotional learning.
Thank you.
Is SEL. That is a great question. And in multiple other grants, and grants in progress and funded grants, I am currently working to how do we bring early prevention interventions into the school setting. We have a current grant right now with Joan Luby that we're testing in preschool through first grade. We're training interventionists within the school that focus on that early emotion development and how do we keep kids from getting worse. And the school setting is a huge opportunity for more universal interventions that we should in fact be leveraging more. I know Neha and I and others have talked about how do we take the social emotional learning intervention that she has developed and bring that into schools. So I'll let others, Neha or anybody else want to touch on that.
Yeah, I'll just quickly add, so because there's been a well-established evidence based, obviously based on that question, for social emotional learning curriculums in the school setting, and even in the preschool setting. And so what we've been exploring is an intervention model that is based on more prevention learning curriculums, but using it as more of a targeted intervention to children and also parents and how to support their children in their social emotional learning skills. So that is something we are exploring. I think pairing that with the outcomes of this specific project, we'll look at as we're creating interventions and reaching out to all the school projects, what are also the barriers that we're finding out that come, again, it goes back to that sort of mental health equity model that if we're moving one area, one circle, are we also addressing the other to kind of move it all together? So it's sort of pairing all of these pieces together.
Yeah. Yeah.
Great. Thank you. And perfect job at ending the last answer at right on time. So it's 11 o'clock on time. I'm going to go ahead and wrap us up. Thank you so much for coming and presenting. Everyone who attended, thank you for coming and listening. We'll definitely keep you updated as this project moves forward, and we'll send you an email with all of the resources shared throughout today's presentation in a timely manner. I think the last little thing that I'll share before we end today is that Systems for Action is planning on releasing another funding opportunity in mid-January. So we will be sending out a lot of information about that very soon. So be on the lookout for emails from Systems for Action, and be checking our website often if you might be interested in applying for a grant with Systems for Action. Okay, I'm going to go ahead and end this. Thank you so much for joining today, and we will see everyone soon and hope everyone has a great Wednesday.
Thank you.
Bye.
Bye-bye.